Picture this. It's a beautiful May afternoon in 2017, and MJ confidently and proudly strides across the stage to accept her Bachelor of Science degree in nursing. She inhales deeply and vows to be the best RN that she can be. Fast forward with me now to 2019. She's married and would have not long lost her infant son within weeks of his birth. She's feeling depressed and burnt out from the challenges with interpersonal relationships at work, in addition to the limited material and human resources. She asks for and receives leave for mental health issues. 9 months later, though, as she tries to go back to work, she's told that the time she spent away from clinical practice is indeed too long and was rejected for 3 positions. She wonders now if taking a leave of absence for a mental health issue was the right choice, and in fact, if nursing was the right career choice for her. Nursing is considered the largest represented body of workers in healthcare worldwide, with the scope of nursing practice as diverse as it is complex. And as nurses such as MJ engage in their practice, they are confronted with the need to address a multiplicity of occupational challenges and demands, and their mental health may be adversely affected. In fact, research suggests that psychological challenges such as depression, anxiety, stress, and burnout often result in leaves of absence from work for nurses. And considering the risks and factors associated with nurses developing mental health issues, we wanted to map the literature about accommodations for nurses returning to work after a leave of absence for a mental health issue. And so our purpose was to do just that: review and map the literature, key themes about accommodations for nurses returning to work. Our objective was to summarize the amount, type, sources, distribution, and focus of the conceptual empirical literature. And then we wanted to identify and discuss key themes and gaps in the literature. And so with that in mind, we used a 6-stage methodological framework for scoping reviews as proposed by Askin O'Malley and advanced by Levac and others to standardize and clarify the procedures used at each stage in our review. And the first stage, we identified the research question, and for us, it was, what is the scope of the literature about accommodating nurses return to work after leaves of absence for mental health issues, including the amount, type, sources, distribution, and focus of the conceptual empirical literature, and what are the gaps in the literature. In the second stage, we identified relevant literature through the search of 9 electronic databases, and the next 3 stages included the extracting, coding, and collating of the data. We inductively arrived at our findings, which were summarized both thematically and numerically. And so what we found was that initially we had 1,393 records, but once duplicates were removed or records out of the scope of our research question were excluded, we were left with only 6 records. They were all from America, various parts of America were represented, and they were published between the late 90s and 2018. Half were journal articles, the other half were dissertations, and the majority of them used quantitative methods. Now, the body of literature, although scarce, does provide valuable insights into return to work accommodations for nurses following leaves of absence for mental health issues. Generally, the literature provided no clear definition for mental health issues. However, definitions were provided in 5 of the records for terms such as mental disorders, substance, alcohol, and other drug use as factors contributing to mental health issues. There was one record that identified chemical dependence or psychiatric illness affecting cognitive, interpersonal, or psychomotor health as the defined focus. And the population was primarily RNs, but some LPNs were included. Half of the records did not indicate the workplace, but the other half was a mixed bag from acute care to specialty areas, community home care, nurses in education, as well as long-term care. We were also able to identify three major themes that emerged from the literature. They were alternative to discipline programs, or ADPs, peer support, return to work policies, procedures, and practices. And the ADPs, which focus more on a restorative process through which nurses not only return to work, but receive the requisite supports. This approach sharply contrasts more traditional programs that were more punitive in their approach. ADPs have proven more effective in helping to retain nurses as well as to help with their return to work. The second major theme that we identified was peer support, and peer support programs have been found to provide the means for nurses to not only help themselves, but to help colleagues navigate the struggles of recovery and their eventual return to work. Nurses participating in peer support groups or programs were found to enjoy better outcomes than those who did not. It was suggested that support from colleagues and managers is vital to assisting nurses transition back to work. The third major theme that we identified was what I will refer to as the 3 Ps of policies, procedures, and practices. And these were considered vital to accommodating nurses' return to work following leaves of absence for mental health issues. They differed widely across states and based on the nursing regulatory bodies, but still found to be of great importance. Clear, widely disseminated accommodation policies, procedures, and practices were required to help ease the transition of nurses' return to work following leaves for mental health issues. And though there were useful insights, we did find various gaps in the literature. There was an overall paucity of evidence regarding programs, policies, and practices to support nurses' return to work following leaves for broader mental health issues beyond alcohol and other substance use disorders. Things like anxiety, depression, and PTSD, burnout were not represented in the literature. The majority of the articles in our review, 5 of them, focused on ADPs addressing the combination of alcohol and other substance use disorders. Only one study included other mental health issues identified as a psychiatric illness, in addition to alcohol and other substance use disorders. While the benefits of ADPs are directly and indirectly addressed in the literature, 4 of our records, little empirical evidence is published addressing the effectiveness of the ADPs, the experiences of nurses who participate in them, or a comparison of experiences of nurses enrolled in ADPs with those enrolled in traditional disciplinary programs. Only one record addressed that. The literature offered no comparison of ADPs of varying lengths and components. Neither did the literature offer a gendered approach to explore the experiences of nurses who have participated in ADPs. In conclusion, I say to you that while the literature supports alternative to discipline programs as the primary accommodation supporting return to work of nurses, more on the effectiveness of these programs is needed. Empirical evidence is necessary to develop, maintain, and refine much needed return to work accommodations for nurses after leaves of absence for mental health issues. We have 3 takeaway messages, and they are simple. Many nurses potentially will need accommodations to return to work following leaves of absence for mental health issues. Alternative to discipline programs, peer support, and specific policies and procedures play a pivotal role in return to work for these nurses, and empirical evidence is scarce but necessary to develop, maintain, and refine much needed return to work accommodations for nurses after leaves of absence for mental health issues. A gendered lens is also very much needed. Thank you so much for your attention. I will take any comments or questions at this time.